Good morning. My name is Tom Boatsman. I'm president of Misericordia University. And on behalf of the Board of Trustees, the Health Advisory Council, the faculty, staff, the administration, and our students, I welcome you to our beautiful campus and the 6th Annual Healthcare Symposium, Patient-Centered Care, Proven Experience, Expect the Best. Last year, I reported that the number of students and credits generated by health science programs account for almost half of what we do at Misericordia. It's part of our tradition of care for women and children, service to others. Healthcare is a large part of what we do. I'm happy to tell you that this year that number has gone even higher. We continue to expand our footprint in the health sciences field. Our health sciences student body is composed of traditional students and adult learners. Misericordia is truly the regional leader in the education of healthcare professionals. I'd like to thank our sponsors who each year enable us to offer this program at no cost, and I especially want to thank them. This year we have over 300 registered participants, so we've obviously moved to a bigger location, and our sponsors have stepped right up and been very generous to support this program and keep it without cost. I'd like to also ask to stand up or give us a wave so you can be recognized. Cor Catena, President, Wilkes-Barre General Hospital and Commonwealth Health. Thank you, Cor. William Conaboy, President, Allied Health Services, Integrated Health System. Thank you. Mary Irwine, President, Irwine Home Health and Hospice. Mary, thank you so much. Brian Rinker, Vice President of Northeast Pennsylvania Region for Highmark Blue Cross Blue Shield. Thank you, Brian. And Frank Trembulak, Executive Vice President, Chief Operating Officer, Geisinger Health System. Geisinger is enjoying their 100th anniversary this year, so right now the score is Geisinger 100, Misericordia 91, but we're catching up. We're working up to our 100th in just 9 short years. Thank you to the Healthcare Advisory Council for the support of Misericordia's health sciences programs. The council provides us advice on our health sciences curriculum while providing outstanding support to our recruiting efforts. The council recommended that we engage today's keynote speaker, Dr. David Feinberg, President and Chief Executive Officer of Geisinger Health System. Council members, please stand and be recognized. Finally, I'd like to make a special thank you to our speaker, Dr. David Feinberg, who's going to address profound changes as they're transforming the caregiver-patient relationships. I'd like to now turn the program over to Dr. Joe Grilli, co-chair of the Healthcare Advisory Council, to introduce our speaker. And Joe, thank you for shepherding us through all this. I know it started 6 years ago, and we'll think about maybe the Houston Astrodome in a few years if we need more space. So thank you so much, Joe. It's all yours.
Thank you, Tom. And thank you for coming. We're delighted, as Tom said, to host the 6th Annual Symposium. It took a lot of work by the Health Advisory Council and us, and again, I just have to thank you guys, because only you know how many hours you put in. And again, we exceeded our previous total of registrations by about 110. So this is a larger group, and I want to announce that next year, we plan to go to an expanded format, probably a half a day. We're going to offer more robust CEUs, and we're probably going to get you out of here shortly after lunchtime. So if you're interested in that, there will be breakout sessions after the keynote speaker. So we will have a keynote, we'll have breakout sessions, and then we'll probably have a lunch and a short afternoon session. And the other important thing I want to mention to you is there are evaluations in your packet. Please fill those out, because we use those each year to evaluate not only the current year's symposium, but also how we plan future symposia. So please take a minute after this is all over to give us your evaluation about today, and also about what you think would be appropriate for future years. Now it's my distinct pleasure to introduce today's speaker, Dr. David T Feinberg. Dr. Feinberg began his tenure as the 6th Geisinger CEO on May 1st, 2015, after a long, successful career at UCLA. Dr. Feinberg is triple board certified in child and adolescent psychiatry, adult psychiatry, and addiction psychiatry. He graduated with distinction from Chicago Medical School, completed a pediatrics internship at Loyola University Medical Center, and fellowship training at the UCLA School of Medicine. Dr. Feinberg earned his MBA degree from Pepperdine University. His many awards and recognitions include the Cancro Academic Leadership Award from the American Academy of Child and Adolescent Psychiatry, Medical Center CEO of the Year, Healthcare Leadership Award by the Los Angeles Business Journal, Distinguished Fellow of the American Psychiatric Association, Outstanding Physician of the Year by the UCLA Neuropsychiatric Institute and Hospital, Outstanding Physician of the Year by the Southern California Psychiatric Society, Leadership, Vision, and Commitment Honoree by the National Health Foundation, and member of Alpha Omega Alpha Medical Honor Society. The author of numerous articles and chapters, he is the leading speaker on attention-deficit hyperactivity disorder, autism, pediatric bipolar disorder, adolescent substance abuse, and the industrialization of medicine. Described as a hands-on clinician leader, it is my distinct honor to introduce Dr. David T Feinberg.
Thank you very much. Good morning. I really liked talking down at a lower level, but then I don't think I could connect. So my wife, Andrea, and I are going to go this afternoon. I have some work to do in New York, and we're going to see our daughter, Rachel. And Rachel is 23 years old. And 22 and 3/4 years ago, so Rachel's about 3 or 4 months old, first child that we had. We have 2. And we're sleep deprived. So if you think back to being in training, I think I was a child psychiatry fellow where we didn't have duty hours back then, so you actually worked a lot of hours. Really tired, and an emotional time of being a new dad. I always wanted to be a dad. And I get this patient. I'm training in child psychiatry, and this is a young man who's 12 or 13 years old, and he's had a first onset psychotic break. And his mom left when he was young, and he's been raised by his dad, and his dad is a car salesman from Las Vegas. And just picture car salesman and picture Las Vegas, and you got his dad. And so they come to UCLA because we had this inpatient unit, and the kid is pretty profoundly catatonic, kind of frozen and psychotic. And you heard the introduction. I'm a smart guy. I went to good schools. I got good training. I know a lot. And I'm sitting in my little office with the father and telling him the diagnosis. And I'm talking about neurotransmitters and dopamine and reuptake and how we're going to block it and anticholinergic side effects and how we're going to treat anticholinergic side effects, because I'm actually really smart. And the dad looks at me, and he has tears in his eyes. And he says, "Hey, Doc, are you telling me I need to build a room out back?" And I just started crying. And I think I started to cry because I was sleep deprived, because I was a new dad, and I understood that the trajectory of his child's life just changed dramatically. And it was a great lesson for me, I was using medical mumbo-jumbo to avoid really connecting with his father. And he taught me that as a clinician, talking in plain English, or whatever the native language is, to patients and really engaging with patients around questions as important as, should you build a room out back, is probably much more important than neuroleptic malignant syndrome. And that experience kind of kept focusing me back on, I'm not that smart. It's a really privilege to be with people, especially at a vulnerable time, and what's the best way to connect with them? Fast forward a couple more years. Now we have 2 kids. They both go to a school, the little public school nearby. We kept in Los Angeles because traffic is so bad and the public schools are so bad, and we didn't have a lot of money for private school. You could move to certain areas and get a pretty good public school. So we went to this public school for our 2 kids. Now, it's Los Angeles, so it's fun at the public school because Hugh Hefner's kid went there, and I was always available to go for pick Ryan up when he had a play date at the Playboy Mansion. But so that was Los Angeles, and we're in that school, and a little girl in 3rd grade, about the same age as our kids now, writes in her haiku poem that she wants to tie yarn around her neck and kill herself. And you can kind of guess what happens. The teacher doesn't read the haiku poem till the night after the assignment, so a couple days later. And it's a long time ago, so we didn't all have our cell phones and stuff like that. So the next day, the teacher comes to school and gets the principal. The principal's a pretty incredible man that we remember from back then, and says to the principal, this little girl wrote 2 days ago in her haiku poem that she wants to tie yarn around her neck and kill herself. And so the principal calls the mother, and the mother, I hear the story later, the mother then calls the dad at work. And the dad relays to me later on, this is the first time his wife has ever interrupted him at work, so he knew something was wrong. Said to the father's assistant, no, you need to get him. So they called UCLA. UCLA at that time, well, probably still at this time, one of the best places for child psychiatry in the country. A lot of the money from the Kennedys, when they had mental retardation, went to UCLA, and so autism, mental retardation, bipolar disorder, this is the place. And they called UCLA, this is the same school, it's about, I don't know, half a mile away, where my kids are, for an appointment. And I got to see him. And this was my patient. And it took them about 3.5 weeks to get in for the appointment. And that's because they knew somebody. Because if they didn't know somebody, it would have been closer to probably 6.5 or 7 weeks. So they come in to see me, and it was pretty easy to treat the childhood depression in this particular case. I was trained well, kind of knew what to do. Cognitive therapy works really well in young kids. We don't have to use meds. You know, I could say after an hour and a half sitting with the family, your kid's going to be okay. She's going to grow up. She's going to be in, she's going to be in Girl Scouts. She's going to have friends. We're going to be okay. Here's the trajectory. Here's what's going to happen. And there was tremendous relief on the look of their parents' face. And as I was driving home from work, I was thinking about how much pain they were in during the 3.5-week wait time. But the reason that they had to wait 3.5 weeks was because healthcare was all, and I'd say still is all centered around the provider. It's what's most convenient and what makes most sense for the doctor, or in this case, the child psychiatrist, as opposed to what makes most sense for the patient. Because when that mom got the call, when the dad got the call, just put yourself in those shoes. And if you put yourself in those shoes, particularly with mental illness, where there's even more stigma associated with it, there's shame associated with it, you can't talk to anybody about it, and then your little 8-year-old is suicidal and you have to wait 3.5 weeks. Or, if it's a medical condition, you got a new diagnosis that the radiologist called and the mammography doesn't look good, or an elderly parent falls or is having memory problems, all of us want to be seen today. Or actually, we'd like to be seen yesterday. But that's not really how our system works. So about 8 years ago, I described myself as the happiest guy in the world, 2 nice kids, an incredible marriage. I got this great job at UCLA. I'm half-time basically seeing kids and adolescents. I'm focused a lot on kids in the juvenile justice system. I like kids with drug abuse problems and regular child psychiatry stuff, autism, ADHD, et cetera. And I'm an administrator. I went back to school, I got my MBA, and I'm running the psychiatric hospital, which is fantastic because I really kind of feel like I get to do both things. And the guy in the job that I had now for the last 8 years at UCLA, the CEO of our health system kind of leaves unexpectedly. And at that time, there is, it's a bad time at UCLA. We were moving into new buildings, and there was no money, and the buildings were delayed. And the dean comes up to me, and he says, listen, if we went out right now to get a CEO, nobody would come here because we're in bad shape. So would you mind doing it? And I said, no problem. I'd be happy to do it. And, I'm really good at writing Ritalin prescriptions, and so therefore I'm qualified to take on this role. So the first couple days on the job, people are asking me questions, and I literally feel like I'm in a Charlie Brown classroom where it's just blah, blah, blah. I don't even know the words they're saying. Would you like to, Dr. Feinberg, you're the new CEO, how many bunkers should we put in the MOB? I'm like, this is a really hard question for me to answer. I don't know what a bunker is, and I don't know what an MOB is. So I'm like, should I say 2? Should I say 200? I don't know what the right answer is, is it a fraction? I don't even know what they're talking about. So a mentor of mine says to me, when I get this job, he says, listen, these are really complicated jobs, and don't get distracted by a lot of things. Just focus on one thing. Just focus on one thing. Doesn't tell me what the one thing is, but it's kind of guiding me around just focus on one thing. So really to decrease my anxiety, because neurosurgeons were coming up to me and talking about block time and throughput, and those were words that meant nothing to me. I had no idea what they were talking about. I went to where I was most comfortable, and where I was most comfortable was sitting on patient beds and asking, how's it going? So for the next 3 months, probably 2 hours a day, and I still do this to today, I would just walk around, knock on doors, and say, can I come in? Hi, I'm Dr. Feinberg. I'm the acting or interim chief executive officer here. Can I come in and see how the care is? And I'd sit down on the beds, and I'm at this place. UCLA is a pretty famous place. We invented the PET scan. We came up with Herceptin. We diagnosed the first case of AIDS. We do more organ transplants than any hospital in the United States. We transplanted a person's arm. We're going to do a face transplant. This place is pretty incredible. And what I heard from our patients, actually I'd been on the job 8 days. 8 days on the job. We went from U.S. News and World Report, 3rd best hospital in the 6th best hospital in the country to the 3rd best. I said to the dean, look, 8 days on the job, I moved us up 3 spots. So on that same day, I meet people who tell me, you don't have enough bedpans, you don't have enough wheelchairs, the hot food's not hot, the cold food's not cold, I can't wait to get out of here, even though you saved my life. So I got in the back of my mind this thing, pick one thing, and in just a stroke of brilliance, I said, okay, we're going to focus on the patient. Hello, it's a hospital. So I say, we're going to focus on the patient, and I start talking to groups about doing it, and this is 8 or 10 years ago. People weren't talking about this. There weren't these things called HCAPs. There wasn't Medicare focusing on it, and people looked at me with really 3 different groups. The first group, and it was mostly the nurses, looked at me and said, finally, this is what we do, this is what we care about, great, we like you. Then there was the group that just didn't listen whatsoever and kind of looked at me like, why'd we put the psychiatrist in this role? He's just acting or an interim. He's not a real CEO. We've had customer training before. I got a coffee mug. This is stupid. The kind of like, you have no idea what you're talking about. And then there was the group in the middle that was kind of on the fence. And so we kind of, people asked, well, the long story short is we went from, on patient satisfaction scores, in the 38th percentile among 6,000 hospitals in the United States to the 99th percentile in a very short period of time. So we became the most patient-centered, if you believe the surveys, on would you refer us to a friend or rate us on a scale of 1 to 10. Huge, huge difference. And we did it at this academic medical center. It was a public institution. We had residents. There were 2 great hospitals on either side of us that had private practice doctors that acted in a much more kind way and all that kind of stuff. We got to same-day appointments for 27 specialties. and really kind of set the bar, at least in healthcare, for patient-centeredness. And got a lot of attention, and people came to see what we were doing, and they wrote books about us that became New York Times bestsellers. And to get 99th percentile patient satisfaction, by the time we got better, everyone was on board. So we had kind of converted people. And I don't think we really converted anyone. People said, oh my God, that's such an incredible change in culture. I don't think I changed the culture at all, or my team changed the culture at all. I really think that it's in everyone in healthcare. We just unleashed it. And stuff happened that was pretty amazing. As far as kind of these stories where you're just wowed beyond belief what we did to help patients. So we had 99th percentile patient satisfaction, so you'd say we're great. Well, to get 99th percentile patient satisfaction in the hospital business, you have to have 85 out of 100 people check off the box, yes, I'd give you a number 9 or a 10, or yes, I would always refer you to a friend. Well, that means by definition that at the best place in the country, 15 of the last 100 patients that we cared for would not refer us to a friend. I'm board certified in psychiatrist, so I can tell you out of those 15 people, one is officially crazy. But the other 14 people are regular folks. They're people like you and me, they're cousins and brothers and sisters. And they really always had one of two complaints, and sometimes it was combined. We didn't communicate what we were doing, and we didn't coordinate the care. I mean, that was always the problem. If you would have communicated, one doctor said this, one said this. If you would have coordinated the care, you told me that I'm going to have my procedure tomorrow morning at 8 o'clock. It's 5 o'clock, I haven't eaten, and nobody's told me anything. So we kept trying to kind of work on that and try to think about, well, we need to be different than we need to still take care of those other 14 and maybe even that 15th person who's crazy, because some people would come and say, I want you to give my husband a brain transplant. I'd say, I'm sorry, we don't do brain transplants. Well, I'm not happy with the care. So maybe we even need to fix that one piece. And then I keep thinking about there's more. So I sent a team of about a dozen people because everyone's talking about this place in central Pennsylvania called Geisinger. So I sent a team from UCLA to find out what Geisinger's doing. You know, Geisinger's getting a lot of publicity. Al Casal's here. There was this thing they did that was so innovative. Actually, now it's kind of pretty commonplace, but about 10 years ago, they say, if we're going to treat a heart surgery patient, we're going to make sure they need surgery. We're going to make sure that they get everything done, nothing extra that they don't need, and we're going to provide it for one price, kind of a bundle. And then if you left after surgery and you had some kind of infection or problem, you'd come back and we won't charge you extra for that complication. Now, it sounds pretty reasonable if you're not in healthcare. If you're in healthcare, it was the opposite. In healthcare, in those days, if you got an infection or a complication from surgery, it meant we charged you more because we had to treat the complication. So pretty incredible innovation. And the Wall Street Journal called that the first warranty in healthcare. And Geisinger labeled it proven heart. And there were other things that Geisinger was doing that other places were talking about and trying to do, and we were trying to do it at UCLA. And one was this. Basically, what if you took care of patients with chronic disease in one building and everything they needed was coordinated and cared for? Everything. The therapist, if they needed therapy, was in the room, in the office. Pharmacist to take care of the medications. The insurance company to make sure nothing falls through the crack. The doctors, the nurses, the physical therapy, the pharmacists for the meds. Kind of a home for your medicine, this kind of medical home concept. Again, way ahead of everybody else. And so I had this, I wasn't alone. I don't think I am alone. I was kind of intrigued with what was going on at Geisinger. Now, I wasn't really looking for a new job and was really happy in Los Angeles. And Geisinger called. Do you want to take a look at this job? Dr. Steele's retiring. And I sent an email to my wife saying, this could be the one. Let's go check it out. And so, really not looking, but willing to, but I was intrigued. I wanted to kind of figure out well, first of all, I thought if I interviewed, I'd learn a lot that I could bring back to UCLA, right? I'd learn more about the organization. But what I found was, to me, unbelievable success with incredible possibilities going forward. And some of it was by mistake. Or at least now looking back, I didn't even know what I was talking about or what I was thinking about. So Geisinger, as you heard, turned 100 years old last month or 2 months ago. And I think looking back at that history, which I've now tried to become a student of, is really important to get you to where we are today and where I hope we'll be going tomorrow. So 100 years ago, this woman named Abigail Geisinger, at age 85, 100 years ago, was not 85 like it is today. So with all due respect to Mrs. Geisinger, that's really old, right? If you're 85 years old 100 years ago. Same year, women are told, Congress votes women don't have a right to vote. So a woman, a different woman than the woman today as far as rights and stuff, says, build me this hospital, make it the best. But I don't trust the bankers in Danville, so I'm going to go by horseback for 3 days and bring all my money up to some banks up here in the Northeast, deposit it here, and then every time we need money to pay the bills to build the hospital, I'm going to come back on horseback, 85 years old, back and forth. I don't think there was Highway 81, to get the money back and forth. So incredible to me, that vision, that woman, I think that's really important to who we are. At the same time, she hires the first doctor that's the first resident graduate from the Mayo Clinic. And he does something that, again, today seems very commonplace, but if you go back 100 years, it's mind-blowing. He says we're going to have an employed physician model. It's almost would be sacrilegious to have an employed physician model because doctors were a profession and have to have their own professional thing, and we're going to employ docs. Now a lot of people are employing docs, but we're talking 100 years ago. So employ docs, and then this early bet on electronic health record. There's this company called Epic that I would say is the market share leader on electronic health records, especially for large integrated systems like ours and many others. Really expensive. It's not great, but it's probably the best thing out there. But nobody heard of it 20 years ago. Geisinger was the first outpatient Epic install. So we made a bet really on this startup that's now an insanely large and successful company. And we went early with electronic health record. And then we did something else that, again, I think is pretty lucky. We were founded in central Pennsylvania. And as I've come to learn, the people here are really different. They're really, really nice, and they like to work hard. So I don't think you could have had this success had we not had Abigail Geisinger, this employed physician model, this early bet on data, and the people that make up our system. So I come out to Geisinger. I say, let's go for it. And I do what I do best, right? I want to spend every day meeting our patients and talking to our frontline people. We got a lot of Geisinger people here in the audience, and I hope I've met all of you. We have 30,000 employees right now at Geisinger. Our payroll every day is about $7 million, right? So it's a big organization. We do about $6.6 billion a year in business. And I want to meet everyone. I want to know everyone's name. That's the kind of guy I am. And then I meet people now. I've been on the job about 6 months. And people go, oh, I'm finally meeting you. Finally? I'm like, I think I have 30,000 people to meet. I think I've met 2,000 people. You're actually in the beginning. But so I get out here and I want to see everything. I want to see and meet and feel what's going on. I want to be in the room with patients. I was in the room yesterday with patients. To me, it's really important to see how we do all this stuff. And every day I come home and I say, we made the right decision. I got chills. And I start telling my wife, you won't believe what I discovered today. This is how good we are. I'm going to get to the bad part in a second. But how good we are is... there's this thing in healthcare called the observed to expected mortality ratio, or in essence, the death ratio. You could say that if patients get admitted to the hospital, and you had 1,000 patients, and based on their illness, 100 would be expected to die, how many died? And if 120 died, you're not doing your job. If 100 died, you're doing exactly your job. And if 80 died, you saved a few more patients than you were supposed to. So Geisinger, which is now pretty big, our insurance companies in 5 states and our clinical enterprises in Pennsylvania and New Jersey. In May, through all of our hospitals, our observed to expected mortality ratio, or that death ratio where 1 is normal and below 1 is really good, was 0.5. I'd never heard 0.5 in my life. GWV, which is probably 10 miles from here, had an observed to expected mortality ratio in May of 0.2. You could say that at Geisinger, Wyoming Valley in May, we saved 5 times as many people as anybody else did. It's pretty amazing. When you go to our clinics, whether they're one here in Dallas or Shamokin or Lock Haven or Bloomsburg or Danville or Mifflinburg or Jonestown or State College, and you go into that place, we have that medical home where everyone's there to take care of you, and if you need to be anticoagulated, if we need to thin your blood because you had a stroke or you got some heart problem, we don't want to give you too much of the drug because you'll bleed unnecessarily and it'll give you another stroke or something. And if we don't give you enough of the drug, it won't work. So it's a very complicated thing, and we've turned that over to pharmacy to manage. And we were the best in the United States in anticoagulation until a few months ago when we found out we beat Switzerland, and now Geisinger is the best in the world in anticoagulation. So when Abigail Geisinger says, make it the best, I'm like, wow, that's pretty good. Observed to expected mortality ratios that I've never heard of. When you have a heart attack, we need to get you from the door of the emergency room up to the cath lab with the balloon opening up the little block in your heart in under 90 minutes. That's the standard in the United States. You got to do it under 90 minutes. If you do it in 49 minutes, you're at the 95th percentile in the United States. Geisinger's at 42 minutes. So it's just over and over these concepts of, wow, this system is spectacular. Part of the recruitment when I came out here, they told me that it's a stable population, and I said, oh, that's great. That means they're emotionally stable, right? I come from Los Angeles, so we're going from, so no, emotionally stable is not what they were talking about. Well, I found the people to be quite emotionally stable. They're really talking about a stable population in that we met people the other night, and they say, I'm the 8th generation person living in my house, and all my neighbors and friends are the same people. We live here. It's stable, meaning no one moves, right? So we got this stable population, which is a really helpful thing if you want to study genetics or personalized medicine. So we did this project that we're calling My Code, which is basically run people's full DNA. So when you hear about this DNA sequencing, which used to cost $100,000, can be done for about $1,000 now. So let's look at your DNA, let's look at your gene, your genetic blueprint, and then we can do precision medicine or precisely treat you based on your DNA. Well, when you do these studies in Los Angeles or New York or anywhere else, and you ask people, can we sample your DNA for a study? 15% of the time people volunteer, because not everyone wants to be in research. When we ask to our Geisinger group of people, the 3 million people that we provide care for, 90% of the people said, of course you can take my blood, it's a privilege to be part of the study. So think about that. We got 90% of the people volunteering to be in a DNA study. All those people live here along with their parents, grandparents, cousins, uncles, brothers, and sisters. So we got all the family together. We made that early bet on electronic health records, so we have 20 years of clinical data that we can abstract. We also own an insurance company, so if you didn't get some of your care at Geisinger and you went to some other place, we know about that because we paid the bill for that. So we got the whole picture on you. And now we can say, wow, what does this allow us to do different? And can this be done anywhere else in the US? So how does it play out? Well, this 16-year-old girl comes in a few months ago. She's dehydrated from soccer practice, lightheaded. We give her some fluid, send her on her way. She agrees to be part of the My Code study. We run the DNA, and she has these genes that are predicted for that fatal cardiac arrhythmia. You read in the newspaper, you see on TV that student athlete falls over and dies unexpectedly. She's got it. Probably when she was dehydrated a few months ago, it wasn't dehydration, it was probably the heart was going bad. Well, we look at the DNA, we look at all her family, who's all volunteered to be in our study. We look at our claims data of all her family, And Uncle Bob choked in a restaurant a few years ago and died. He didn't choke in a restaurant now that we have this information. He likely had the cardiac arrhythmia. Well, now we bring 30 people into the office, and we say a few of you need to get pacemakers, a few of you need to be followed long-term, and a few of you are okay. Nowhere else in America can you do that. Nowhere else can you do not really precision medicine, which is figuring out what's wrong with a person, but this is really anticipatory medicine. This is figuring out what's wrong before it's wrong and preventing it. About 1 in 170 people have this thing called familial, this is a hard word for me to say, but I'm going to try to get it. Familial hypercholesterolemia. Pretty good. High cholesterol genetically, not high cholesterol because you eat the wrong stuff. If you have high cholesterol because of your genetics, if you get this thing, and you're a male, you have a 50% chance of having a stroke and a 50% chance of having a heart attack. The American Academy of Pediatrics says if you have this gene, you should be put on Lipitor or other statins at age 8 to prevent what's going to happen. So we're running the genes and we look at it, and yes, about 1 in 171 of our patients have it. We look at their clinical information. They have high cholesterol, not high enough that any of our doctors would ever treat it. It's not abnormally high. They're over age 8. We bring them in and say, we have to have a real discussion. We think you have this gene and you should get treated with this medicine. Otherwise, you got a 50% chance of having a heart attack or stroke later in life. Nowhere else in America is doing that. So to me, it was this opportunity of a lifetime. America's watching Geisinger. We got all this data. We have the best doctors, the best nurses, the best support staff anywhere, and we got this patient population who wants to participate with us to change the way medicine's delivered. And I'm actually pretty humble. I can't take any credit for that, right? That's all pre-me showing up to the scene. But there was something else that I learned as I kind of walked around and met with patients, and those same people that volunteer for our studies, those same people that actually work for us, because many of our workforce are our own patients, we don't answer the phone the right way. We tell you if you had a stroke, we can't see you for a couple of months. We sometimes treat you as if we haven't been expecting you. We send you bills that you don't understand. You know, we, like other healthcare organizations, are not particularly user-friendly. So I say, with my experience that I've had before, and with this incredible opportunity, well, what if we got a little more patient-centered? What if we did, instead of proven heart, and that proven medical home, and that proven acute care, and that proven chronic care that we've done, which means these are kind of, we know the right pathways and we get rid of the variation. What if we did proven experience? And what if proven experience was, we'll answer the phone, everybody will get a same-day appointment if they want it in any specialty, not based on acuity. So if you got the afternoon off and you want a well-woman checkup, we got somebody who can see you. We'll treat you like we've been expecting you. It'll be compassionate. It'll be dignified. It'll be culturally sensitive care. Of course, it will be high quality and safe. We're actually really good at that. We'll make your transitions in care remarkably smooth. You'll come home from your hip replacement. There'll be a box at your front door that opens magically, and it's got the stool already built for the shower, and it's got the bedside commode, because we know what you need when you go home. We'll even try to prevent you from coming in the hospital. If we can treat you at home, even if it means we lose money, we're going to send paramedics to your house and treat you at home for 3 or 4 days for your heart failure instead of bringing you in the hospital. And this one, if you can actually believe this one, most people don't, we're going to send you a bill that you can understand. So we're going to throw away that EOB that no one gets, that is in small font, that you have no idea what it is. And we're going to send you a bill that looks like a restaurant bill or a supermarket bill, and it's going to be for people even with low health literacy. You saw the doctor, $20, right? It's going to be very, very clear. And back to that concept of warranty or guarantee, well, our purpose or our promise is that the care is going to hit all those spots, and at the end, you would refer us to a friend or rate us on a scale of 1 to 10. And if we don't, I think because we're Geisinger, we got to go a little farther. We're going to say, we'll give you all your money back. So we'll be the first healthcare organization in America, maybe the world, that comes with a warranty or a guarantee that we're going to treat you like you were my mom, my brother, my sister, like the kid who had schizophrenia or the kid who was depressed. We're going to do every single thing right. That's our promise to you. And you're the judge. If you don't think so, we're going to apologize. We're going to try to fix it for the next guy. And as a small token of appreciation, we're going to return all your money. So as I'm saying this with the team and people are kind of looking at me like I'm crazy, we started experimenting with it. And something incredible really happened. As we started doing this, patients that we have on our advisory committee said, no, don't buy us off. It's not about being bought off. When you make a mistake with us, what we want is for you to own it and apologize. And then we can talk about a refund. So we've come out with an app that we are going to, it's out. I'll tell you all how to play with it if you want, called the Proven Experience app. The Proven Experience app will officially launch Tuesday of next week, but we're already in the soft launch phase. And if you go to the Apple Store and you go to the Proven Experience, Geisinger Proven Experience app, the first thing you get to is the page that says enter your code. Well, we got to give patients a code because we don't know what their copay or out-of-pocket or deductible was, so the code tells the app how much their ultimate refund could be. So if you put in 5100 as the code, I think that's a spine surgery patient or a bariatric surgery, and you can get either a $1,000 or $2,000 copay, but you can play with that one. And then it was, how's the care? Good, bad. If it was good, you want to leave us a message. If it was bad, what went wrong? Would you like us to contact you? I didn't like my doctor. I had a confusion on my bill. And then you go to the next page on the app. This process takes you about 5 seconds. I'd like a refund. And you go to the refund page, and now it's been loaded. It knows how much you paid, $2,000. And there's a sliding scale. And you can ask for $100 back, or you can ask for $2,000 back, or anything you want. And then you put your name on the next page in the app, and you get a check within 3 to 5 days. And we're doing it in a way that I don't think we've ever done in healthcare. So when you go into Starbucks and you want to get a coffee, and you order a double latte with soy milk and 2 equals and whatever you order it, and the barista makes it for you, and you sip it and you don't like it, Starbucks says, we will make you a new coffee or give you your money back. Starbucks has never, I've never seen anyone in Starbucks, the barista sip the coffee and say, no, we made it right, you have to drink it, right? We've never seen that. But that's what we do in healthcare. That's what we do in healthcare. We sip the coffee and say, we made it right, it met the standard of care, I'm sorry. We don't often even say, I'm sorry, but that's it. So we want to go to a model that's much more consumer-directed. And the reason, I think, is a couple-fold. One, I think it's the right thing to do. It'll make us a better organization. We've already written some checks back to people, and I hope we've learned to get better by those kinds of comments. But 2 other things are happening. One is, and I kind of think they're related, one is in our insurance business, over 50% of those that we insure, we have about 500,000 patients that we insure with Geisinger Health Plan, over 50% of them are choosing Geisinger Health Plan as opposed to getting Geisinger Health Plan as the only option from work. That number used to be much smaller. It used to be you got your insurance from work and that's what you got. Now with all these exchanges, people have options. They get to pick what they want. Now, while you were always paying for your health care, and that's why our wages didn't go up because we kept having increases in health care costs, there was a disconnect because you weren't really writing a check for it. You weren't really picking it. You got what you got. Now, over half of the people we insure are picking us. Very kind of retail model when you think about it. So over the last few months, as I've been thinking about this with a great team that helps support the big changes at Geisinger, I've presented this to other groups. I was at a group with, I call it my CEO group therapy, and it's the CEO of Mass General, the CEO of Memorial Sloan Kettering, the CEO of Aetna, the CEO of Cigna, the CEO of Press Ganey, which is the big national patient satisfaction company, and a bunch of others. And they asked me, so how's the new job, and what are you doing? And I said, oh, well, I'm going to do this thing, and talked about proven experience. And to a T, every single one of them said, David, you're making a big mistake. Don't do it. Healthcare is different. this doesn't make sense. Really, you want to get high patient experience. Patients don't care if they wait. Patients don't care what the front desk is. It's all about trust with the doctor. If people like their doctor and they trust their doctor, they'll keep coming back, don't worry, but that's all you should do. That's all you should do. So I went out of the meeting, out of my group therapy, feeling kind of dejected, like these are smart guys, I trust them, and they're telling me that this is a mistake. And then I started thinking, what was the meeting like at Kodak when somebody said, digital is the new future? What was the meeting at Blockbuster when they said, we're doing great? Everybody comes into Blockbuster and gets one of their top 3 picks on movies because we got a lot of them stacked there. They're in and out quickly. We're selling a lot of Raisinets. People are buying the licorice, and it's working. We're making money doing this video thing. And if Blockbuster compared itself to the competitor, the little mom and pop video store or the other national brand, Blockbuster was winning. It was winning the game. So to me, I think an industry that's 18% of the gross domestic product of the United States is going to be totally disruptive as soon as the money goes to the people who are really asking for the care. A study just came out that you spend 20 minutes driving to the doctor, 40 minutes on average waiting for the doctor, and 15 minutes with the doctor. That waste alone is trillions of dollars a year. And I don't think people are going to put up with that. I think our industry is going to be disrupted in the same way the taxi industry or the hotel with Airbnb is being disrupted. That people want care when they want it, they want value from the care, and they certainly don't want to wait, and they want it to be kind and friendly and understandable. They want the same things that I've been trying and that those patients taught me early on. Now, I don't know if a money-back guarantee or a warranty is the right way to do it, but I do know that if we don't figure out how to do it, somebody else is going to figure out how to do it, and that disruption is coming. So stay tuned. It's, to me, opportunity to kind of focus on probably what I think the most important tool a physician or a nurse or anyone in healthcare has, and that's our ears. And if we really sit down and listen to the patients, those that it is a privilege and an honor to serve, not only will they tell us what's wrong with them, the most important part of figuring out diagnosis is the history, listening to what's going on. They'll also tell us what's wrong with the system. And it's a system that I think we need to fix for 3 reasons. I think we need to fix it because it's just the right thing to do. I mean, morally, I think we should take good care of patients because that's why we signed up to do this. I think morally we should provide care to patients that's not only high quality but low cost, because if all the money's going into healthcare, we can't build schools and we can't build roads and we can't give people wage increases. So the real divide in our economy right now is because we haven't had wage increases, and because the reason we haven't wage increases is because there is so much waste in healthcare. I think we got to own that. So we need to do it because it's morally right. I think at Geisinger we need to do it for another reason, and that's because, as I've come to learn in this incredible place called Central Pennsylvania, Northeast Pennsylvania, and South Central Pennsylvania, and New Jersey, most of the people we treat are our friends and neighbors and relatives. It's really us taking care of ourselves. It's really people just caring for people. And then finally, I think Geisinger has to get it right because America's watching us. And I think if we get it right here, it's going to translate into better care, as we've already demonstrated with some of the other things that we've done in Geisinger throughout the country. And that, to me, has this really exciting, profound opportunity that I'm thrilled to be part of. I just want to thank all of you for your time. I look forward to some questions and answers. And stay tuned. Thanks so much.
Dr. Feinberg will be happy to answer any questions. Just raise your hand, we'll get you the mic.
If people don't ask questions, I bring out PowerPoint.
Eric?
Eric Williams, member of the Healthcare Symposium Committee. You talk about the physician, you talk about the healthcare organization. How are you going to engage the patient moving forward? Because there is some responsibility on the patient for their own care. And, excuse me, I know in a lot of chronic diseases, compliance for patients taking their med, seeing a nutritionist, or doing other things is very important. So how is your vision to engage the patient more in their own care for their own well-being?
Yeah, I think that's a great, great question. I think there's some behavioral economics things that you can do. There's these new really expensive drugs that are life-saving, and I think you can do some complicated things with insurance, like, yeah, we'll give you this drug, but it costs you $10,000, and then if you keep taking it the right way, you keep getting your money back. So there's that stuff. That's not really where my heart is, although I think that's important. If I said to you, I got a winning lotto ticket in my pocket. It's worth $10 million. I guarantee it is the winning number. Trust me, it is. I need you to do 3 things. I need you to eat right, exercise, use alcohol in moderation this week. That's all you got to do. Would you do it? I think you would, right? And if I told you, okay, it's $100 million, but now I need you to exercise, 30 minutes every day, no alcohol, wear your seatbelt, be careful with firearms, eat right, and you need to do it for a month. Most people still kind of say, okay, I'll give it a shot. And if I bump it up to $250 million and tell you you need to do it for a year, you start thinking about, well, yeah, I think I could probably pull this off. All I want you now to do is, eat right, have a sense of community, get enough sleep, exercise, no illegal drugs, alcohol in moderation, wear your seatbelt. That list, it's the list of the things your mom has been telling you to do, and you get $250 million at the end of the year. Well, actually, if you do that this year, I'll give you something better than the winning lottery ticket, right? I'll give you your health. And when you talk we probably have 2,000 patients right now in our Geisinger hospitals. And if they did that, I think 1,000 of them would not be in the hospital. And those patients that are in the hospital right now, some of them have great means, some are rich people that have $250 million, and they'd trade $250 million right today for their health. So this concept of getting people engaged in their health, to me, is absolutely crucial, and is something that the behavioral economics piece is important. We pay, if I go through a stop sign, my driver's insurance goes up. But if I eat the wrong food and I'm covered through a group policy, it's the same price. So there's some behavioral economics things, and some companies, Geisinger, for example, has a lot of wellness programs, and you get a decrease in your health insurance. But most of it, to me, is really people buying in to how important and how valuable health is. As soon as you lose your health, you'd trade anything, or a family member, to get it back. It's worth more than the winning lottery ticket. So to me, it's an absolutely fascinating question, and I think we need to do both. I think we need to capture people's hearts and minds around how healthy is. Now, the other thing that's pretty clear is it's really hard to be healthy when you're in poverty. That improving the psychosocial situation for people allows people to have better health. And we've seen that with obesity, which is different among poverty versus people of means. You see smoking rates. People of color have worse health because of poverty. So, it's the economy, stupid. But ultimately, it's about people taking ownership of their health. I think it's absolutely crucial. Yes, please.
Yeah, I'm Dr. Feinberg.
Oh.
I was at a conference last week, a rescue conference. It was interesting because all of the speakers in the conference are decrying the formula companies for the reason that women don't breastfeed. But the real reason is that we live in a country where the government is run by Altria, Philip Morris, Diageo, and companies McDonald's, that make people fat, that make people drink, that encourage people to smoke. and there's no public health program or public health planning by the government. How do you overcome that?
So,
If Michael Bloomberg is the commissioner of health, I think it becomes easy.
Yeah.
But living in a country where, Philip Morris is the commissioner of health, I think it becomes challenging.
yeah, I agree with you. So it's the same question, and the healthcare problem that we have in America is going to be solved partially by the cool stuff that the Geisingers of the world do, and in most part by these kinds of things, by changing public health, by changing psychosocial services. If you put the graph up in the PowerPoint slides of how much money we spend per person in the United States on health and compare it to our outcomes, we're like below Uruguay. We're like really expensive and our outcomes are terrible. So you could say the healthcare system in America is broken. But there's a little bit of a lie in that. If you add the next slide to that, which shows how much do those other countries spend on social things and on sidewalks and on community centers and on support for people that have difficulties, they spend a lot. And when you add that to their healthcare spending, it becomes equal to our total healthcare spending. So the healthcare system has been burdened with a lack of spending in America on those other important parts of public health and social well-being. And we're not equipped to do it. So people come into the hospital because they're homeless. It just doesn't make sense, right? So that part has to get addressed. Yes, please.
I actually have two questions. I'm wondering what your vision is for advanced practice nurses within the Geisinger system. They have a particular expertise in health promotion and disease prevention. And the other question I have is, given that we have this ring of America, what type of steps do you see Geisinger taking to help deal with this changing population demographic?
Thanks. So to repeat, if people didn't hear, you want to know what Geisinger's doing with advanced practitioner nurses and our aging population. So I think we're saying something really wrong in healthcare reform. Everyone keeps saying that one of the reasons to decrease the cost is, get the doctors doing the doctoring and not the secretary, and get the nurse doing the nursing and not having to do the social work. Everybody should be working to the top of their license. I think that's actually, I'm picking on this, but I think that's wrong. I'm actually licensed as a physician and surgeon, both here in Pennsylvania and California. I don't think any of you want me working as a surgeon, but I'm licensed as a surgeon. So I think we want people actually to work to the top of their training. I just want to change that word a little bit. Mid-level providers, independent providers, even in this state, I don't think we have pharmacists as independent providers. We have this huge burden on care. We have people very well trained to provide the care. And with all due respect to my physician colleagues in the room, when you get that going right, when you go to a minute clinic at CVS or one of our Geisinger urgent cares, which is physician assistants and nurse practitioners, and you look at the quality of the care, it's better than the doctor. Okay, so they actually follow the protocols better, less overuse of antibiotics, et cetera. So I'm wildly in favor of it. It makes sense for so many reasons. It allows us to extend our care. It allows people to work at the top of their training. So I think we do a lot. I'm not totally up to speed yet with the state of Pennsylvania, but I think it's particularly behind the times as far as nurse practitioners go compared to other states, but that's a separate issue. The graying part is absolutely crucial. And I think the tsunami of cognitive impairment and dementia is just hitting, and it's almost the same answer. We need team-based approach. We need people in the community. We need, if you want good health care in America right now, the number one thing you need to do is have a daughter, right? So you need a daughter, if you're an old person, that's going to coordinate everything. Or for my parents, the best thing they ever did was get a really good daughter-in-law, right? Who's going to organize everything for them. So if you don't have a daughter, we either address it from a public health standpoint or it falls onto the medical side. We got to provide that good daughter to everyone. Yes, please.
Hi, I'm Michael Frederick with Salesforce. I'm in our healthcare business unit. I have 3 sons, so I guess I'm in trouble. But
You hope they marry well.
that's my goal.
Yeah.
My question's around information technology. You talked about early adoption of Epic, the MyCode project with the genomics, and now launching the app. And yet you also talk quite a bit about that one-on-one engagement with the patient at the bedside. So how do you manage that, and how do you balance collecting the data and getting that information that you can use in front of the patient to better know them, better care for them, with not having the doctor glancing at his laptop or his iPad or the technology and letting that get in the way of that connection with the patient?
So I think we're right now in a transition. I think the transition is we're way behind every other industry, right? And we took all this paper information and digitized it. It didn't necessarily change our workflow, and all these systems are not particularly user-friendly. But imagine a day when you come to the doctor, you have a smart card on your dashboard, they know you're going to be in the office in 6 minutes from the time you park your car in the parking lot. There is no waiting room because we believe patients shouldn't wait. You come in, you room yourself into room 6. You know you've actually created part of the discussion because you know what's going to happen in the office and you set up the agenda. You open the exam room. Imagine this, and the doctor is sitting waiting for you. They've been expecting you. They say, I brought a specialist in because we've been examining you from our at-home monitoring. We actually apologize that you had to come in because that's a failure in our system, but we got the specialist here. I think I need a second specialist. He wasn't available in person, so he or she is going to be here via telemedicine, and together we're going to go through everything we need to do to care for you, and instead of looking at the computer, the technology guys figure out how to have that just virtually put on the wall. As we look at it, we create the note together, we discuss it. It's a whole different process. I think all that stuff is coming in some force, or Google Glasses that bring up your high blood pressure from the last 4 visits as I'm checking your blood pressure. Right now, it's really clunky. We're in this transition phase. But other industries, Salesforce is a great example, know who's calling them. When you show up for surgery, it's like we're starting all over, as opposed to kind of having that customer relationship management where we know you. I think Amazon knows me better than my doctor. I mean, when you think about it, I bought a shirt, they keep asking me, do I want a shirt? I bought this black rug that the dog messed up, so I bought a second black rug from Home Depot. They keep telling me you want a third black rug. I mean, they know me really well. But you go into the doctor and they ask you questions, you're like, do you really even know who I am? So that allow us to catch up. Yes, please.
I'm a nurse practitioner in Bradford County, Pennsylvania, and when I came to hear you speak, I didn't know you were in psychiatry, but I find that a bonus because I think that we are woefully underserved in the care of our mental health patients. We're in the middle of a heroin pipeline here, and I just want to know what Geisinger's doing.
Sure. So, you know what makes me angry is there have been a lot of people dying from heroin addiction and lives ruined from heroin addiction, but no one cared about it until it started affecting middle-class families. That part really bugs me. So I'm board certified in addiction medicine. I ran a methadone clinic in Los Angeles for 7 years that was treating 1% of the heroin addicts in the United States, a very, very large clinic. I was ordering 1% of the methadone of the whole United States, and I was an ADHD doctor, so I was ordering Ritalin and Adderall all the time. The DEA and I were like best friends. They thought I was some kind of pusher. So it's been affecting a lot of people for a long time, and now that it's affecting people that are on the other side of the tracks, all of a sudden we got a lot of attention to it. So we still got to treat it. And there's some crazy ideas in Massachusetts about locking people up for 3 days if they have addiction and stuff like that. We can take any heroin addict today, put them under anesthesia, give them basically a medicine that wipes off all the heroin out of their system, take them through a terrible withdrawal, but they're under anesthesia, so they don't feel it, and they wake up and they're not addicted to heroin. No withdrawal, nothing. They're done. They're done. We could do it in 1 hour. Or you can do it with meds, or you could do it with methadone over 5 years. The problem is addiction is a very complicated disorder, and that anesthesia wipeout has about a 0% effective rate because to get to become a heroin addict, a lot of different things went wrong in your life, and we got to work on those things so you don't go back into that pathway of heroin addiction. So it's complex. It's in this epidemic, and all these epidemics go like this in drug abuse, A lot of it has been caused iatrogenically, doctors overprescribing opiates. It's not just bad doctors that for $100 will write you a script. It's regular doctors not paying attention or seeing patients so fast because of our system that they just keep giving meds and people get caught up in it. You get hooked on oxycodone or Vicodin, and then heroin is cheaper and easier to get, and then you're off to the races. What Geisinger's doing, I was just with our pharmacy team yesterday, and hey, I tell you, we're the world's best in anticoagulation. If you got diabetes or hypertension, we got those same pharmacists manage this. Our new thing is we're hiring all our graduates from Marworth, which is our substance abuse treatment program outside of Scranton. I forget the town it's called. Waverly, what's it called? Waverly, that's pretty good, huh? I'm naming all these Pennsylvania towns. And we're going to have pharmacists embedded in our clinics to manage opiate prescriptions. So we're going to do it the same way we've done it every time. Team effort, use a lot of data, get people early, and then make it close to home. I mean, so it's the same concept. And we'll win this one, and then we'll see what's coming next. But again, if you really want to solve the heroin addiction, give young people jobs and a sense of purpose in life. You got nothing else going on. Opiates make you feel good, you know, when you're not feeling good. Yes, please.
What do you consider to be the biggest obstacle in getting your patient-centered care paradigm into the fabric of the Geisinger being with the 30,000 employees and the hundreds of locations?
I don't see obstacles. I think I'm positive it's going to happen. I mean, I don't see resistance. I see a great workforce. I mean, come on, how are you going to argue with me? I'm talking about motherhood and apple pie. I'm talking about we're going to take good care of patients. I mean, if we were a restaurant, should we serve good food? I mean, it's to me, it's the opposite of visionary. It's exactly what we should be doing every day. That's why we're doing this. So as it spreads through the organization, 99% of the people say, thank you. This is what I do. This is what I want to do. Hey, you got to help me. We got to get these obstacles out of the way so we can do more of it. And maybe there's 1% that doesn't believe that we should take good care of patients. They went to healthcare for some other reason. The culture will just spit them out. So I don't see obstacles. I see incredible opportunities, and I'm just wildly optimistic. And then what happens is it takes off beyond what I could even imagine. There was a case at UCLA where this young woman had a ruptured aneurysm in her brain, giving birth to her second child. A beautiful young lady. And I got friendly with the husband. And he didn't want to sleep in her room in the ICU because it was disturbing her, so he kind of commandeered this waiting room next to her room, which was just separated by a wall. We just moved into this new fancy hospital. And I like cookies, and they always had cookies in his waiting room, so I'd go by every day. How's it going? Have my cookie. And he said, you know, will you go tell that lady in the waiting room across the way, it was across this balcony, that I'm not a stalker? Because, you know, these waiting rooms, when you sleep in them, if you turn at nighttime, it's on a motion detector, and the light goes on in the waiting room. So you can't sleep. He goes, so I put tape over mine, and then I was watching this other lady try to sleep over there, and I saw she kept getting the light turned on. So at 2 a.m, I went over and I taped her thing. What a nice guy, right? And he goes, but I think she thinks I'm crazy. So will you go tell her I'm not crazy? I'm like, sure. So I go over. He's a nice guy. How is it? Nice to meet you, whatever. The next day I go to see him, and he looks at me and he goes, you're incredible. You know, this is incredible what you've done here. It's amazing, amazing. And I'm like, I didn't get what had happened between one day and the next day. And he motions over to the light detector, and it's gone, and it's now a light switch. And it's a 1 million square foot hospital, and every waiting room now has a light switch. Every motion detector's been taken out. It wasn't me. I'm a fool. I should have thought of it. It was somebody else heard his same story, and the organization said, oh, that's a patient dissatisfier. We don't need to have meetings. We don't need capital improvement. We don't have to go to anyone. We're going to change every light switch in the building so this doesn't happen to anyone who's sleeping. And those kinds of things happen when you unleash people's potential. They're not top-down. They're bottom-up. They're saying to people, take care of patients, treat them like family, even if it's against the law or against the policy, and we got your back. And then incredible things happen. So my job really is just to be the unleasher, and the incredible things that will happen from those 30,000 people that put their badges on that say Geisinger. And I would venture to say it would happen in any place in healthcare. I don't think it's particularly unique to us. Why don't we take one more? I think I'm supposed to stop.
I had the privilege of bringing my son to the ER recently, and when I looked around the room, there were quite a few people who have been waiting a long time, and those who didn't seem to have smartphones or any sort of technology that would allow them to access the app that you were talking about. And I'm wondering if you have a plan for how you will reach those people who can't go to the Apple store but still want to talk to you about their patient satisfaction.
So only a lot of our patients actually don't have computers, but most of them do have smartphones. But that's not really what you're asking. So this service recovery is available in that everyone at Geisinger, I think we started distributing it yesterday, so all 30,000 people will have a service recovery toolkit on them as part of their uniform, and the service recovery toolkit will have all of those things in it. So and the requirement will be that you need to use your service recovery toolkit, which is a coupon for a free meal, free valet parking, an ability to write something off. You must give it out every month. So you can't hoard it. You must find places where we messed up and give it out. Let me just close with one story that gets to this point. So we'll get to, you don't need an app to get the refund. You just say, if something didn't go wrong, right, we'll say to you, would you like a refund? So it'll be a very personal kind of way. That'll be part of our recovery. So Mercedes dealer sells a car, you get it home, the headlight doesn't work. And you call the dealer, you spend $100,000 on the car, and the light doesn't work. And so the dealer says, oh, I'm really sorry, Mr. Feinberg, I'll be right over to your house. And he comes to my house, and he delivers me another brand new Mercedes. Sorry for the inconvenience. He takes the one that I just bought with the broken headlight, drives it back to the dealership. Literally gives me a new car for the inconvenience. And you're like, wow. And you tell your neighbors, you got to buy a car from these guys, they're great. Great. Because when you provide perfect service to people, you don't create as great of brand loyalty as when you mess up and recover, right? You create that moment. Great. It's a great story, isn't it? The only problem is the dealership was doing it on purpose. They were purposely sending home broken headlights so they could create that moment. And then they got in trouble, okay? Hey, we're in healthcare. We don't have to knock out headlights. We got headlights going out all the time, right? So we have this opportunity to create that brand loyalty engagement by saying, we're really sorry it happened. We're going to go above and of our way to fix it. And that's what the app is going to do, and you don't need to do it through the app. I appreciate everyone's attention. I love the questions. Thank you very much.
Thank you so much, Dr. Feinberg. We just have a few minutes left, so if you could stay for a few moments and fill out your evaluation forms, please. Before our closing comments, though, I'd like to welcome to the podium Michael Pheasant, a senior biology major and the president of the student government of Misericordia University, to make a special presentation. Michael.
Thank you, Mr. Grilli. Dr. Feinberg, on behalf of the student body and the entire Misericordia community, it is my privilege to present to you a token of our appreciation for your valuable time and wonderful insights this morning. Thank you, Dr. Feinberg.
Thank you very much. Thank you very much. Appreciate it. Thank you. I'm hoping it's a... Thank you so much.
Thank you again, everyone. Fill out your evaluation forms, please, and we'll see you in 2016.